Welcome to the Jaypees Institute of Medical Science. Today we shall discuss about the diagnosis of pregnancy. In last class we discussed about the diagnosis of pregnancy in the first trimester. In this class we shall discuss about the diagnosis of pregnancy during the second trimester. Welcome friends to the Jaypees Institute of Medical Science. Today we shall discuss about diagnosis of pregnancy during second trimester. In last video we discussed about the first trimester. Today we shall discuss about the second trimester. During second trimester, some of the symptoms present during first trimester gradually disappears, like morning sickness, increased salivation, and frequent micturition generally disappears during this period. An important symptom felt during this trimester is quickening. The active fetal movements are felt by the mother at the end of 16th week. The term quickening is applied to the first recognition of the fetal movement by mother. The date of quickening, if ascertainable from the patient, is helpful in reckoning the period of pregnancy and calculating the probable date of delivery. Diagnosis of pregnancy during the second trimester, there are some change occurs in the mother. Number 1, changes in the screen. Number 2, changes in the shape and size of uterus. Number 3, intermittent uterine contraction. Number 4, active fetal movements. Number 5, palpitation of the fetal parts. Not palpitation, actually, palpation of the fetal part. Number 6, auscultatory signs. Number 7, perception of fetal movements. Pigmentation is one of the characteristic change that takes place in second trimester. It is marked more on the forehead and 6 in the form of brown patches. It may also be seen on the breast and over the abdominal wall. Uterus becomes ovoid and can be felt at different levels in abdomen in successive period of pregnancy. This is known as Braxton Hicks sign and is found irrespective of fetus being dead or alive. These contractions occur throughout the pregnancy as long intervals and last for few seconds. When felt for or seen afford positive evidence of continuing pregnancy and a live child, they are noticed after 16th or 18th week of pregnancy. Palpation of the fetal part. About the middle of the pregnancy, the fetus is generally increased to a size when it can be recognized by the abdominal palpation. Palpation of the fetal part. As pregnancy progresses, this sign is of value not only in detecting pregnancy but also in ascertaining the various position of the fetus in utero. Auscultatory signs. Auscultation over the abdomen during pregnancy is useful to elicit various sounds, some of which are great information in the positive diagnosis of pregnancy. Fetal heart, it can be heard from about 17th to 20th weeks of the pregnancy using Pinner's fetoscope. This is the only sign of pregnancy which by itself, in the absence of others, is perfectly reliable for the diagnosis. That is, the fetus is alive or dead. The points of greatest intensity of fetal heart sounds vary within the position of the child in utero. Ordinarily, the fetal heart beats 120 to 160 times a minute. Ultrasound Doppler echocardiography can also be used to monitor fetal heart beats. Visualization of heart motion by ultrasonography is possible from the 7th week of pregnancy. Other sounds that may be heard are due to movements of the fetus, intestinal movements, and maternal aortic pulsation. This may be elicited by the external or internal manipulation producing a passive movement of the fetus in utero. With this, we have come in the end of the diagnosis of pregnancy, In the next classes, we shall discuss about dysmenorrhea. Thanks for seeing this video. Okay friends, we have come in the end of this video. If you have liked this video, please give a like. If you are new in this channel, please subscribe this channel. Also push the bell button. Please give your comment in the comment box. Your like, comment, share will encourage me to make such more video in future, so that you can learn these medical things more. Thank you for seeing the video. धन्यवाद.